Deputy Healy.
And just to welcome the HSE staff in relation to this issue. And I suppose, first of all, to pay tribute to ambulance personnel throughout the country who work above and beyond the call of duty, not just on a daily basis, but on an hourly basis, trying to provide a very important service to the public. And I think what the staff want, and I suppose what we all want, is best patient outcomes for patients who avail of the ambulance service. But I think what is clear from the various presentations this afternoon, and indeed from our own experience, in our own constituencies and at local level, I think it's quite clear that there is a resource issue. There is a lack of resources available to the ambulance service throughout the country. And I believe, and as I've said in an earlier response, that a capacity review study is absolutely necessary to ensure that a proper service, a quality service, is available to the public. There's no doubt that the resources available to the ambulance services in this country does not compare favourably with resources available in other jurisdictions. And we've had those figures from both the NASRA representatives and the SIPJO representatives earlier. So I believe, Cathaoirleach, that this committee should recommend immediately a capacity review study for the ambulance service. And I think it's urgent, it is important, but it is urgent, and it should be undertaken immediately, because currently there is a review being undertaken by the HSE nationwide, and certainly I'm aware of it in the southeast area, and particularly in South Tipperary, where there is currently a review ongoing. And I believe that that review is effectively putting the cart before the horse. It's reviewing a situation in circumstances where we simply do not know what the required resources are. And I would want to put on record here with the HSE senior management that there is absolute opposition to the reductions in the ambulance service being proposed at the base in Cashel, where an ambulance is being proposed to be lost and transferred effectively to Carlow. And indeed, I want to compliment the Tipperary Ambulance Action Group, who've come together at very short notice, and who are the members of the public who are quite clearly opposed to the loss of the service, because they know and they believe that the loss of this service to Cashel will mean that response times will be even worse than they are now, that we certainly will not see the response times that are recommended by HIQA, and we will see a less than adequate ambulance service for South Tipperary. And indeed, I also include Clonmel in that, because the review proposal involves the loss of an ambulance in the AM for Clonmel as well. And what is happening currently, Cathaoirleach, in South Tipperary is that the ambulances from the county are being pulled to cover situations in Kilkenny, in Carlow, in New Ross, in Waterford, and in Dungarvan, where obviously the resources are not up to are not up to strength, the effect of this is the effect of this now means that the senior management are coming with a proposal to effectively downgrade the service significantly at Cashel and also, as I said, at Clonmel. Now, I would also want to say this, that I would have thought that the Haddington Road Agreement provides for the retention of existing roster patterns, and I would contend that any change, as is proposed at either Cashel or Clonmel, is in breach of that particular agreement. And finally, Cathaoirleach, as I say, what we all want is best patient outcomes, but certainly the proposals that are on the table for South Tipperary, and particularly for the Cashel ambulance base, would not be in the best interest of patient outcomes, and certainly will be opposed strongly by the people of South Tipperary. Thank you.
Thank you, Deputy.